Welcome to Section 8 of Public Health Sciences. In this video, we'll discuss quality and safety in a healthcare system. Let's get started. Here's an overview slide of what we'll be discussing in this lecture. Let's begin by discussing safety culture. Safety culture refers to an environment where everyone is responsible for patient safety. It's important to remove fear of censure for reporting problems to achieve this culture. This can be very difficult in a traditional healthcare system, which tends to be very hierarchical, and it can be tough to report on an attending who made a mistake. However, the main point here is that there is a shared goal of decreasing medical errors and maintaining patient safety that overrides any other concern. It's also important to have event reporting systems in place to enable tracking of errors in the system. This is essentially a computer system that allows adverse events to be tracked and studied by an independent third party. Next on our list is a concept known as human factors design. Human factors design refers to a system designed to minimize potential for human error. There are three main aspects of this. The first is known as forcing functions. A forcing function is something that wakes the user up while they're doing a task. It's something that interrupts a task to make sure you are doing it consciously. An example of this is when a doctor prescribes a medication to which the patient has a documented allergy in the EMR. The EMR might even have a pop-up asking if the physician is sure that they want to prescribe this medication, forcing the physician to confront the documented allergy and decide whether or not to override it. There are numerous other examples of this throughout the EMR and built into other medical devices. Another way to reduce human error is through standardization. This comes in the form of checklists, guidelines, and algorithms, so the physician is forced to review evidence-based protocol before taking any action. Finally, simplification is another important design element when reducing human error. An example of this would be implementing an automatic calculator for determining a weight-based drug dosage versus having to do the calculation manually each time to reduce mathematical errors. All right, now let's discuss something known as the PDSA cycle. The PDSA cycle is an effective method for implementing quality improvement into a healthcare system. It's really not rocket science, but for some reason has a fancy acronym associated with it. It consists of 4 parts: P for planning, D for doing, S for studying, and then A for acting. As you can see, the first letter in each word provides us with the acronym PDSA. Planning involves identifying the problem and proposing a solution. Doing is where you test out your solution on a smaller scale. Then you study or analyze the result. And the final step is to act, where you implement your solution into a new workflow, assuming your test results were encouraging. All right, before moving on, let's do a quick practice question to help solidify some of this material. You are a surgical resident providing post-operative care to an elderly man who has just undergone a hip replacement operation. You prescribe him a high dose of oxycodone to help with his significant post-operative pain. While you are signing this prescription, the computer asks you to verify your credentials. You do so, and the computer then requires you to review the patient's information and enter their patient MRN to ensure you are prescribing opioids to the right patient. Which of the following best describes the information above? A. Standardization of care. B. Forced function. C. Simplification, or D. Dual authentication. All right, the process described in this vignette should come across as a pretty clear example of forced function. Before prescribing this potentially dangerous medication, you are being required by the computer system to verify that you are prescribing it to the correct patient. This is a classic example of forced function, requiring someone to make sure they are doing something correctly and not allowing them to do it on autopilot. So the correct answer is B. Forced function. A is incorrect because standardization of care refers to implementing protocols to allow for the best evidence-based practices to be incorporated into each patient's care. C is incorrect because an EMR asking for patient verification is not an example of simplification. Finally, D, dual authentication, is not a widely recognized design label to help control for human error. So again, the correct answer is B, forced function. All right, moving on, our next topic on the list is quality measures. There are 4 main measures of the impact of a quality improvement change: structural, process, outcome, and balancing. Let's walk through each of them using a specific example. Let's say you're trying to improve infection rates in post-operative care by increasing perioperative antibiotic use. Structural factors are things like equipment, resources, and facilities. These factors are usually the easiest to measure. In the case of our example, let's say you hire a few extra infectious disease specialists to help with antibiotic selection. That is a measurable increase in resources to help achieve your goal. Process is a little more complicated, but essentially is a measure that the process is working. In our example, measuring the number of patients to whom antibiotics are administered during surgery could be an example of a process measure. The next factor, outcome, is probably the most commonly used measure of success. And in this case, your outcome would be post-operative infectious rates, so the impact it has on patients. Finally, balancing refers to taking into account an intervention's effect on other outcomes, positive and negative, so impact on other systems and outcomes. In this case, it might be useful to measure rates of antibiotic side effects, such as diarrhea or allergic reactions among the patient population. Okay, moving on, our next topic is the Swiss cheese model. The Swiss cheese model of safety is illustrated by the diagram on the right. It refers to a system where multiple safeguards are in place to help mitigate risks severe. The model regards errors as a systems issue rather than an individual issue, and they are likely to appear as a result of a problem with your system rather than as a result of a single individual committing an error. This model acknowledges that errors can still occur when all of the holes in the Swiss cheese model line up. Let's illustrate this with an example. Administering the wrong drug to a patient is a classic example of medical error. There are multiple safeguards to prevent this from happening. The pharmacist has to enter the prescription information into the EMR before filling the prescription. He or she then double checks the label before sending the prescription to the floor. The nurse on duty checks the label on the medication against that entered into the EMR. He or she then scans the barcode on the medication label and on the patient's wristband before finally administering the medication. The Swiss cheese model of medication errors predicts that shortfalls in each of these safeguards may occasionally line up and allow for medical errors to occur. Let's say the EMR goes down one night and the pharmacy is short-staffed. The pharmacy tech whose shift it is that night fails to double-check the name on the patient label and sends it to the wrong room. Maybe the nurse on duty has worked 3 shifts in a row because of scheduling issues and is suffering from serious fatigue. He or she administers the medication without double-checking the label, and because the EMR is down, doesn't bother scanning the patient's wristband before giving the medication. If even one of these steps had been carried out, the medical error would have been prevented. However, as the Swiss cheese model predicts, there was a perfect storm of factors that allowed the patient to be administered an incorrect medication. One last concept related to this is the idea of a near-miss event. If the nurse had checked the label right before administering the medication and noticed that it was for the wrong patient and then didn't administer the medication, it would be classified as a near-miss event and should be reported. It's important to recognize these events because even if they didn't cause immediate harm, they should be studied and corrected so that more safeguards can be put into place so that something similar doesn't cause harm in the future. All right, moving on. Now let's discuss types of medical errors. Medical errors fall into 2 major classifications: active and latent errors. Active errors have an immediate impact and include errors that are actively committed, such as operating on the wrong limb. This category also includes errors of negligence or omission. For example, failing to scan a patient's barcode before administering a medication. Latent errors can be understood as accidents waiting to happen. These are system design flaws that predispose to error. An example of this would be putting 2 emergency drugs right next to each other in similar packaging, making it likely that in an emergency situation, they would be mixed up. It's important to remember that errors should be disclosed to patients, regardless of whether they caused harm or not. Okay, last on our list is medical error analysis. There are 2 methods of medical error analysis that are important to be familiar with. The first is a root cause analysis, which refers to a process by which the cause of a failure is rooted out. This process involves a retrospective approach, meaning it is undertaken after an error has taken place and involves interviews and reviews to determine every factor that may have contributed to the error. Using our previous example, let's say a nurse assistant noticed the medication was about to be administered to the wrong patient but didn't feel empowered to speak up. That kind of thing might come out in a root cause analysis interview, and steps could then be taken to change the safety culture to help everyone feel empowered to ensure patient safety. A failure mode and effects analysis describes a forward-looking or prospective approach and is a method of inductive reasoning to try and predict ways that a process might fail and then implementing steps to try and head them off. This process prioritizes possible shortfalls by their probability and impact on patients. This process is a great way to identify latent errors and then take steps to eliminate them. All right, now that we've covered the information, let's wrap up with another question. You are a medical student rotating on an internal medicine service. You are given responsibility for a patient admitted for exacerbation of COPD. While going through your patient's chart, you notice that he has not been receiving his outpatient antipsychotic medication for the past week of his hospitalization. When you mention this to your resident, he says, "Whoops, good catch. I will add that back now." What should you do next? A. Let it go as there was no clear harm done. B. Recommend reporting the lapse to the administration. C. Remind your resident to be more diligent in the future. D. Conduct a root cause analysis to determine how this occurred. E. Inform the patient and apologize for the lapse and recommend reporting the error to the administration. All right, this question is pretty tricky, but there are a couple of clues that make it easier to answer. This is a medical error that caused no clear harm to the patient, but would be classified as a near-miss event and is still valuable to analyze from a systems perspective. However, as a medical student, it's not necessarily appropriate to report your resident without discussing the matter with him first. The key to answering this question is recognizing that with any medical error, it's essential that you inform the patient regardless of the outcome. Therefore, the correct answer is E. Inform the patient and apologize for the lapse and recommend reporting the error to the administration. A is incorrect because an event like this should be reported for quality improvement purposes even if no harm was caused in this particular instance. B is incorrect because it doesn't mention informing the patient, a key step in addressing the mistake. This would also not be ideal because you should first discuss the issue with the resident. C is incorrect because while you may want to remind your resident to be more diligent in the future, you should report the event and inform the patient in addition to this. Finally, D is incorrect because it's not your responsibility as a medical student to conduct a root cause analysis. So again, you are responsible for reporting an error and allowing the administration the opportunity to conduct a root cause analysis of the mistake. And again, the correct answer is E. All right, that should be everything you need to know about quality and safety.